Hi, welcome back to Rohrich Knows Podcast, helping you become a better you. This is Rod Rohrich from Dallas, Texas. I'm a board-certified plastic surgeon. And today we're going to talk about facelifting and the future of facelifting. And do you need a facelift, and what kind of facelift do you need? And I'm here with world-famous Dr. Foad Nahai, who's the past editor of the Journal of Aesthetic Plastic Surgery and a longtime close friend of mine and an adjunct professor of plastic surgery at Emory, a real teacher who gives back, and he lectures around the world. And we were together in Serbia, right, in November.
Exactly.
Yeah.
We had a great time.
Yeah, it's great. Yeah, we met at the airport in Istanbul. I mean, amazing. You think I travel a lot. This guy travels it more. So anyway, Foad, welcome. How are you?
Thank you.
Great.
Doing very well. Thank you. Happy to join you.
Good. And I know you just did a facelift today, so we're going to talk a little bit about facelifts. So, you know, the future of facelifts. So let's just start out with, you know, do you think facelifts are ever going to be supplanted or disappear with new techniques and technology or AI? What do you think?
That's always been a concern, and we've had this debate now for at least 10, 15 years, that with injectables, with fillers, with toxins, with energy devices, facelifts are going to become obsolete. And there was a time during the 2008 recession that facelifts took a dive, but facelifts are back. And frankly, I don't think they will ever disappear, because not everyone is going to start early enough with rejuvenation. Not everyone is going to have all that's available to them that is non-invasive. And as we age, it isn't just the skin, it's loss of volume. And at some stage, it's beneficial to replenish that volume with fat, with autologous tissue, rather than vials and vials of filler, as you and I have seen presented at many meetings worldwide. So the quick answer is that it will not disappear. Will we be seeing as many patients? Probably not, but we will be seeing patients who will need, will need the facelift, will need the volume replacement, and it'll be later stages.
Right. And what Dr. Nahai is saying is so correct. We now understand the science of aging. It isn't just the sagging of the skin, it's the volume loss that is causing the sagging of the skin. And of course, we live on planet Earth, so I think facelifts are safe. You know, I think they're here, they're going to change. The techniques have changed. The technology has changed. They've actually become harder because of some of the technology that interferes with the ability to find the right plane. So, but let's talk about the modern facelift, Fuad. You know, and the hot topic is the deep plane. Now, what is the deep plane facelift, and is it really new, or is it a social media hot button?
I think it's a marketing phenomenon. I think it's a social media buzzword, and there's nothing new about it. The modern era of facelifting goes back to a Swede called Skog, who presented this in the mid to late 60s at the American Association of Plastic Surgeons, published it in his book, and then a well-known, now retired plastic surgeon from Dallas, Sam Hammer, and his partner, Dr. Lemon, took that concept and, if I'm not mistaken, coined the word deep plane. But later in his career, Sam Hammer abandoned the deep plane, started doing something that he called the composite facelift. So that term has been rediscovered. It's become popularized. It's very confusing to patients. But basically, to make it very clear, if we look at the layers of the face, there's the skin, then there's the fat under the skin, and then there's the firm layer that we call a fascia, and the popular one is called the SMAS, S-M-A-S. So I tell my patients anything that we do deep to the SMAS can be considered a deep plane procedure. I don't go into the long history the way you and I are discussing it today, but they ask before they even make an appointment, does Dr. Nahai do the deep plane procedure? And the answer is yes.
Of course, yes. And we've all been doing the deep plane, and it's just a variation of where you do it.
Since the 70s.
Exactly. And anytime you're at or below the SMAS level, which is that musculofascial layer, and you're manipulating it, especially in the outer part of the face, that's the deep plane. And, inherent in that is not only the anatomy, but also it's precarious because you have to understand the facial anatomy and the facial nerves. And if you don't, you can get into a lot of trouble. And I think that's really, what I've actually seen a lot of in people that, quote unquote, have had a deep plane. I don't think I've seen anybody do the similar deep plane. And certainly not only in descriptions in both the journals, but also in live surgery. So I think the deep plane is not a new technique. And you're right, Dr. Skoog really described it. Anytime you go at or below the SMAS, you're in the deep plane. But you have to be very careful because guess what's in the deep plane? It's the facial nerve branches, especially in the lower face. So you have to be very careful. When do you do a SMAS versus a deep plane facelift?
I tell my patients that no two faces are alike, no two faces age the same. So why do the same operation on everyone? It's like going to Chanel or going to a tailor that custom makes your suit for you. You have to custom make that procedure for the patient, starting with where we put those incisions. The second thing is, how much do we undermine the skin? The third thing is, what do we do in the deep plane or under the deep plane? And then finally, what has become very popular are what we call ancillary procedures, such as a lip lift, earlobe reduction, most important of all, resurfacing that improves the quality of the facial skin and basically eliminates the wrinkles, especially around the mouth. So I tell my patients that each of these has to be customized. I look at them, I tell them how and why I place the incisions, which means the scars, as I want them to turn out. And I can tell them just by looking at their tissues whether I'll go deep or whether I'll just do application, and tell them that, I may change my plan while I'm operating on you. Your tissues may not do what I want them to do unless I go deep and release attachments. So basically, we do what we call a bespoke or custom-made facelift.
Right. Yeah, you customize the face to the facial aging, and sometimes you have to do one thing on one side and one thing on the other because everybody's asymmetrical. No, I agree, and I agree with everything. I do central facial fat augmentation, and I know you do fat augmentation as well, because I think it's filling and lifting the deep layers, and that gives you not only the longevity, but I think it gives you a natural look. So what advice do you have for the viewer, the take-home points, when they're confused by all of these incredible things you see on social media and the results and maybe not so results that you see? Are they believable or are they not? So what are your take-home points for our viewers, Dr. Nahai?
I would advise anyone who's interested in having a facelift to do their homework. And that doesn't mean look on social media and have somebody who's probably just finished training tell you that they're the world's expert and they do the deep plane. But look at those who've built a reputation over time. Look at those that have been recognized by local or national media. We have lists of the top 10 surgeons in the country in facelifts, and I know you and I are both on that Newsweek list. And then check around and pick someone who's board certified in their specialty. Pick someone who's been around and has done a number of these, and don't hesitate to ask, how many have you done? Look at the pre and post-op. Look at their publications. Sometimes it's very easy for a layperson to access our scientific journals and books that we have all published. So basically, do your homework and then see somebody that you feel is a good fit for you, that you can relate to. And one of the things that I tell my patients is, we do our best to avoid complications, but you should pick a surgeon that even if you have a complication, you have enough confidence not to second guess your decision. But fortunately, complications are rare.
Right. No, wise words from Dr. Nahai. I just want to amplify really what he said are the 3 E's: experience, expertise, and showing exceptional results. And that always shines true, because if they are a great teacher, a great educator, that's why he mentioned if they're well respected by their peers and they talk about it and write about it, guess what? They're true experts. Because as you know, everybody's an expert on social media and on their own website, but very few people are true experts. And certainly, Dr. Nahai is an incredible world expert in facial rejuvenation. And I'm so honored and privileged to have you with us today, Dr. Nahai. And it's always great to see you, and it's always great to lecture with you around the world.
We have.
Well,
we've been on the podium together so many times. It's good to see you, Ron.
It's good to see you as well. So leave me your comments and thoughts about these incredible wise words from Dr. Nahai. And until the next time, helping you become a better and more educated you. Thank you so much.